Happy Friday!
Right. I've got Rickie Hoppe with me. I'm Dr. Melanie Palm from Arctic Skin MD, and we're over on the non-invasive body contouring side of things.
We are, yes.
And we're trying to do these lunch and learns, and what we thought we would do is actually kind of run through some pearls.
Yes.
For, in this case, we're going to talk about EMsculpt NEO today.
Mm-hmm.
So maybe some myths as well.
Yeah, definitely.
And then I thought it'd be really nice, you know, a lot of times we'll come on and we already have the patient under a device, we're already kind of starting the procedure. Let's talk about like setup so people can see in real time.
I love it. Yeah.
I know it's been a while since I've done one of these maintenance treatments. I was noticing in yoga class that my plank is not as strong as normal, and I lean over patients for a living.
Exactly.
And your core muscles are so important for proper posture and everything I do ergonomically during the day.
Agreed.
So I thought, let's do my maintenance treatment.
Yes.
Let's talk about some of these things, and people can see setup. So if they're a first-time EMsculpt NEO patient, they see what the setup's like in real time too.
Absolutely. Absolutely. So as you see Dr. Palm, she's comfortable, she's got a little knee rest, you know, her head's on the pillow and everything. So we have the patient come in, we have the strap all ready, and we'll kind of show you the process of it. So basically, today we're treating, you know, doing her abdomen. So we treat the skin, so we do have you, you know, lower your leggings or whatever you're wearing.
Low riders like Britney Spears, the 90s are back, so here we go.
Hey, I love the 90s.
Yeah.
And then we're going to take this applicator. So this is kind of what the applicator looks like. You have the center of the heat right there. And depending on each individual, I know we had talked about some people with a wider frame can use 2 applications. It is pretty unique, typically men.
Yeah.
Some of my male patients will. But for her, she has a smaller frame, so we're just going to use the single applicator today. So what we do is we take this, and we're going to, so we have her rib cage right here. We're always going to make sure it's below the rib cage. We do not want it placed above the rib cage. Also to the center of the heat typically goes on the belly button. Everyone's frame is different, but for her it's going to go right above the belly button. I'm going to bring this up here. And then we take this strap, we take this guy here, and we want to cinch it super tight because we don't want it moving. Sometimes it does, and we'll just adjust, and that's totally fine. But we definitely want to make sure it stays nice and secure. So we have this here. And we're going to bring this here. Cinch it, cinch it, cinch it.
A little tighty-whitey on
you,
there. Yeah,
okay?
I know it's good.
Okay.
Yeah.
I'm going to bring this
Cinch it in.
Cinch her in, right?
Yeah, you may find, you know, for slimmer hips, like sometimes
a little bit
patients
lower,
want
that's a little bit better. Perfect.
And I'll help her adjust just so I know that the applicator will stay in place.
Okay?
Yep.
Okay. So now we're going to go ahead and begin. Again, you know, once we start it, we'll usually turn the RF completely up to 100% because typically that feels like a warm blanket, nothing uncomfortable. And then we'll slowly titrate the high fem up because that's a little bit of a contraction. So we just kind of want to adjust you up. You'll be a little quicker because you've done it a bunch. But
and while Rickie's sort of off camera doing that, we'll talk about this. So, you know, EMsculpt NEO has been around several years. We're really fortunate. We had EMsculpt technology. We were one of the first sort of here in California and San Diego to have the device and the first to have EMsculpt NEO in San Diego. And so it combines really 2 technologies, and it's used for muscle toning, so building muscle back. We know that from clinical studies and histologic studies and animal studies that we're building new muscle cells. And then that's a process called hyperplasia. And then of the existing muscle cells, we're actually building bulk back. So that's called hypertrophy.
yes.
And we're able to do that super maximally beyond what you can do with the best crunch in the world, with the best trainer in the best gym.
Absolutely.
This is what a lot of, you know, there was just the Victoria's Secret fashion show. It came back after 5 years. So whatever your feelings are about that. But a lot of they actually showed some of the angels getting treatment. This is how they get their amazing definition with their amazing little bodies of all shapes and sizes now. So I think you know, it helps with muscle toning. That's the high fem technology, the high intensity focused electrical stimulation. But gentle heat is also being applied from the radio frequency. So that radio frequency is the second of the special sauce that we have in this. And if you look at all of the clinical studies that have been completed, it doesn't matter what area of the body, so what location of the body we're using, or the site of the study, or the BMI of the patient. Consistently, we've seen across all studies about a 30% fat loss and about a 25% muscle gain. And I think it is really important, depending on the area of treatment. Some places we are trying to lose fat, like in people's abdomens, and that is a treatment goal. But other areas, like when we're treating buttock, we don't want to lose fat, right?
No,
So I think that's a question I sometimes get asked about. Radio frequency delivered with this is in the booty. We're delivering and tailoring totally different energies, so we're just gently warming the tissues and helping promote healthy tissue, but not reducing fat, which I think is an important consideration in some tissues. In our booty, we typically want to hold on to all the fat that we have.
Exactly.
So in preparation, like when you are talking to patients during their consultation, tell me, like, what is, regardless of gender, regardless of who they are, if they're a good candidate of EMsculpt NEO, what is something that you want them to do in a day or two really leading up to the EMsculpt treatment?
Yeah, absolutely. I definitely say like 24 to 48 hours prior, start thinking about this. You don't have to completely focus on it, but hydration. And I think Christy and I do discuss that in the consultation, but I really want to focus on that a little bit more because hydration is so important, obviously, for our skin and so many other factors in our life, but especially if you're getting this treatment. So when your body is well hydrated, the RF, the radio frequency, is going to work better. It's going to target those fatty cells better because your body is hydrated. I have also heard, too, that it doesn't feel as intense. I don't know, that's a couple comments, but again, it's not that intense, but sometimes they've been like, oh, I'm a little more hydrated today. I don't actually feel it as much. So that was kind of an interesting comment.
And you're welcome to go up.
Yep,
So
we'll do one last jump.
The RF, which is the gentle heat, that feels really nice. It just feels like a gentle heating pad on your skin. It's lovely. But then the high fem, you just have to get used to. I mean, I luckily am a little bit of a veteran to this, so we can tune me up pretty easily to 100%. But it's really, patients need to get accustomed to that because your muscle is, involuntarily contracting more than what you're capable of doing physiologically. So we like to do that in a graduated fashion, make sure that you're comfortable along the way.
Agreed. Yeah, definitely. So yeah, preparation. I know we had talked a little bit about protein. If you want to discuss that a little bit.
So, I get asked a lot about like collagen supplements, and if you listen to any of the like healthcare broadcasts, fitness, biohackers, that sort of thing, they talk a lot about protein intake. And unfortunately, most women, if you go to a nutritionist, I bet most of us are pretty devoid in what we should be getting on a daily basis for our weight for total protein intake. And so, there's a couple studies in the literature that support maybe these collagen supplements, if we're taking them orally, there's a little bit of an uptick in what we make collagen skin-wise. But the reality is when we ingest collagen, it's a huge protein. Our gut breaks that down into little elemental parts, amino acids, and it's at our body's discretion how we redistribute that into our tissues. But if we're getting adequate stores and we're trying to build something like muscle, we need to have the building blocks for doing this. So
true.
I talk to patients about the fact that you really want to be mindful about health and nutrition, your nutritional status, and in particular your protein intake. So I take a collagen supplement every day. I take a bovine source of it. It's a yummy little drink that I take every morning after I do my hike or I do my muscle training. And I think about it and I'm like, gosh, right there I'm getting 20 grams of protein. And, the real benefit is I think, we're being able to supply our body with the parts that it needs, ingredients it needs to build healthy tissue.
Agreed. Yes, definitely. So I think those two, right, the hydration and the protein or something. Otherwise, there's not much preparation at all, but those two are important, especially the hydration. So just, with your morning coffee or your breakfast, just have a couple extra glasses of water. Sorry,
no. It's a Friday.
Yeah, not right. Yeah, of water, and that will help you benefit your results, and honestly just help it feel better overall. So.
And then something that I'm doing that you maybe can't see while I'm doing that we sort of is an expert tip, I would say, for some of our more experienced patients is. I tend to really like to, while I'm doing this, I'm anticipating the pull train. I kind of know when this next contraction is happening. And I'm actually contracting my rectus abdominis muscles. So, your 8-pack or 6-pack, whatever you want to label that, in anticipation of that. Because I think if you've gotten used to EMsculpt NEO and you want to get maybe a little bit extra oomph out of it, I pretend like I'm, Arnold Schwarzenegger in his bodybuilding days. And I make my little ab 6-pack in anticipation because I think I'm recruiting it a little bit functionally myself and then getting the benefit of the actual machinery doing this for us as well. So I think that's a nice little expert tip. I would say the other thing is, we talk about just non-invasive body contouring, and COVID was such an interesting time because there was a national lidocaine shortage, which is our local anesthetic that we use when I'm taking out a melanoma, a squamous cell carcinoma, a basal cell carcinoma on a patient, or if I'm performing tumescent anesthesia to do something like liposuction. It is what we use to make people comfortable during procedures.
Scary,
with the shortage, I really, I think morally and ethically, I felt an obligation. I need to take care of my skin cancer patients before some of the aesthetic treatments. So we really, I think that's truly when a lot of our non-invasive body contouring, muscle toning, fat reduction, skin tightening really blossomed over here because I think it was such a nice option, and I think for lifestyle adoption for a lot of our patients who professionally and socially are quite busy, and maybe they've considered a surgical option but are a good candidate for non-invasive means. There's so much we can do. We combine this often with bulk fat removal with something like cryolipolysis, which Cool Sculpting is probably the best brand known name, and it's what's FDA cleared in the US. And then we will come through with things like muscle toning once we've debulked the fat to get that muscle tone underneath. And I've done that with my liposuction patients too. We've removed the fat and then we help with the muscle tone. For a really, I think, beautiful and multi-tissue layer effect. And there's so many areas. I mean, there's how many approved areas now? With EMsculpt NEO. And so, we can treat circumferentially around the waist. That's a complaint I hear a lot from adult patients that, regardless of their men or women, that their waistline is going away, their muffin top has appeared. In women, perimenopausal and postmenopausally, we know that there's a fat redistribution happening. Our composition of our body, we can stay the same weight and we lose muscle mass and we gain fat. And so we want to think about ways that we can help this. And, if you listen to a lot of these health interest, biohacking, podcasts and YouTube videos, they do talk about, how do we put ourselves in the best position to maintain muscle mass. It's so important. It's for what I do every day, I've got a physically active job that I need to stay strong for. And we know starting in our third decade, we start to lose muscle mass. And you can spend a lot of time in the gym, and I think that's fantastic, maintaining strength training. But this is, I think, one of the best biohacks that just is not being widely discussed in order to build muscle mass so that we're maintaining posture, we're maintaining stability, we're maintaining really things that maintain sort of health status for us in decades.
Lifestyle, like we talked about. I mean, this can help improve lifestyle. We have the new year coming up, which a lot of people have goals. So even if you started your treatment now, you can start seeing results in the new year, or have a goal to start in the new year. But changing your lifestyle, you of course we can do this, and you can get many benefits from this. But it is good. We still want you obviously working on your diet and just keeping yourself healthy in general. That's good for everyone and every.
This isn't an excuse to go grab a pint of your favorite ice cream
every night or something, and think this is just going to be a miracle. So we like to use the word lifestyle, and this can help improve that. Like if it is helping with your back pain or just feeling stronger at the gym. When I did my glutes, I actually, when I was working my glute muscles, doing squats, or I like to run too, I actually felt stronger. It was amazing. So I could do more, and I'm like, wow, this has improved my confidence in the gym and just overall how I feel.
I think it's an additive nice bonus, and I just think, we always look for things that are sort of regenerative and things that are helping functionally and have these lovely aesthetic benefits as a secondary option.
It's a benefit, of course,
So maybe we can talk about, I think a myth is like there's, other than hydration, nutritional status, like, there's a myth that there's a cream that can help with some of this, and we kind of wanted to debunk that, right? So I think we have the cream here.
I have it right here.
And I'll apply it after my treatment, and I've got it at home in my shower, and this is called Elastin Body Transform. And there's actually been a couple of small studies that we've looked at this. So Rickie is amazing and has been doing body contouring non-invasively for a decade, and she was formerly with one of our colleagues that we love, Amir Moradi, who's a facial plastics here in San Diego as well. And so when she was with that practice, they helped to do a study treating cool sculpting to the abdomen. And on half the abdomen, it was blinded, so people didn't know which side that the patient was applying it to. We had the patient apply this twice a day, starting a couple weeks before and continuing, I think, for a month afterwards. And then took a look at photos, before and afters, and then created ghosted images where we put the before and after over one another and created a heat map to look at volumetric changes, either volume add or volume subtracted.
Yeah.
And at our site, around the same time, we were doing the same thing with EMsculpt NEO.
Yeah.
And so what was fascinating from this was, regardless of the technology that was used, and again, this was blinded, and then a very objective means of ghosting these images, we saw a 30 to 50% increase in fat loss, volumetric loss, on the area where we were treating the cream. And so I know, we were talking about this sort of off camera, why we love this. You use this every day. I actually use it every day too, because it's based off of this trihex technology.
Absolutely, and that's what they're known for.
Exactly, it's kind of one of their hero ingredients.
It is, and it works.
Small peptides, tripeptide 1, hexapeptide 2. And they help with collagen and elastin production. So we've seen, when you start using this within 3 weeks, if we take skin biopsies at baseline and 3 weeks into treatment, we see better production from staining of the tissues of collagen production and elastin production. So that's, a big hero ingredient in a lot of the elastin products. But what's really special is this has got hexapeptide 11 in it, and hexapeptide 11 helps with what's called autophagy. And autophagy is when we eat up our own cells that just really shouldn't be there. And so I explain to patients that peptides are these small proteins. They actually can penetrate down the hair follicle. At the base of the hair follicle or the bulb, there's white adipose tissue. And so the peptides come in contact, this hexapeptide 11, with that, and send signaling that those fat cells can then send to deeper fat cells to say, hey, you've been injured, you're not healthy, you need to go be pushed off the cliff and not exist anymore.
It's time to go.
Time to go. The party's over.
Exactly.
And so I always tell patients that this has become standard of care because it's remarkable that a topical cream can really accelerate and amplify results that we're seeing from some of these technologies. And I think that's why it's so important. We've been involved with a fair amount of body contouring studies, and I always want to bring to the forefront technologies that we can use for patients that are evidence-based and can deliver consistent results. And I think this is why this topical cream is in our treatment paradigm, because we see improvements and we know histologically this helps with skin quality, but it's also having benefits if, we are trying to improve fat reduction in areas such as the abdomen. It's helping with that as well.
Exactly, too. And a side note, some of my patients, and actually myself, have noticed a little bit of textural changes, so skin tightening a little bit as well. So that's always beneficial, obviously, as our body fluctuates, we want the skin to tighten as well.
Yeah.
So, we can't make promises, but it is great to do in combination with these body contouring treatments we have. So Christy and I will always discuss this with you during consultations. It's a great treatment, or a great product to use after.
Yeah, and this is a 30-minute treatment. We usually do it as a series initially of 4 to 6 treatments. And then talk to me about maintenance. What's that conversation like with patients?
Yeah, so like she said, 4 to 6 treatments, and we can do it 1 to 2 times a week. Sometimes people just do it once a week depending on your schedule. So within 2 to 4 weeks, you'll be completed with the initial series. In terms of maintenance, just like going to the gym, you're going to work out hard. You're not going to just stop. So we do highly suggest maintenance treatment. So I would say you have a range about 4 to 6 months to come back for a maintenance treatment. We see you 3 months post-op your last treatment. So we take photos, we evaluate, assess how you're feeling at that point. So usually within 1 to 2 months after that, you'll come back and do your maintenance treatment. So some people do it twice a year. So Christy and I will kind of decide that and, suggest that for you as well. And with that too, you buy your initial package, but we do have discounts and stuff for maintenance. So it's just because we're so motivated and how important it is to come back. Again, just like anything we do in life, right? We can do something, work hard, skincare, all of the above, but it's important to maintain, to keep those results going, keep the strength, and just everything overall.
Any final thoughts before we sign off? We won't make people watch my entire treatment.
I know, right? It's 30 minutes. We still have 15 minutes to go.
And I'll just, watch some Netflix. Or just,
and that's the beautiful thing. We have Netflix, you can relax. She works so hard. How about you relax a little bit?
Okay, I won't.
I'm going to make you.
You know that won't happen. So,
exactly.
But we want to thank you guys. Rickie is such a wealth of knowledge, as is Christy, who's our other non-invasive body contouring expert. Rickie has returned to us on Fridays, so she's here several Fridays a month, which we absolutely love.
Yeah.
So if you have questions, during business hours, you can call us at 858-792-7546. We have a lovely website that is a wealth of knowledge as well.
Right.
If you want to do a little research on your own, it's artofskinmd.com. But we welcome you guys to come in and see Rickie for a complimentary consultation. And until next time, we'll see you guys soon, okay?
Bye.